Oman. We're going to be joined by our guest to talk about some health stories today and to highlight a very important celebration. Okay, it's World Hygiene Day. So right now we have Dr. Hussain. Hello and good morning, Dr. Hussain. Welcome to the show.
Good morning.
Good morning. How are you doing today, Doctor?
I'm fine. Thank you very much. Hope all are well with you.
Yes, indeed. Well, also, Dr. Hussain, we're so happy to have you in the show, and we would love to know the World Hygiene Day. Can you tell us about this specific occasion?
Yeah. World Hand Hygiene Day. It's a global effort that has been led by the WHO. It's a campaign, a global campaign that launched 12 years ago in 2009. And it's celebrated annually on 5th of May each year.
Right.
The slogan for this year is Seconds Save Lives, Clean Your Hands. In 2021, this year, the WHO, the World Health Organization, called on healthcare professionals and facilities to achieve effective hand hygiene action at point of care. It is something that, as a healthcare professional, we think is very important to celebrate every year, to raise the awareness about the importance of hand hygiene.
Well, I believe that it's very important as well to raise awareness, hand hygiene, and this is what we need these days. So can you tell us also, Doctor, the facts and, statistics about it?
Yes. If we look into the global impact, every day, at least 500,000 people worldwide contract nosocomial infection. Nosocomial infection means an acquired infection from the healthcare facilities. 20,000 of them, up to 50,000, they could die because of this infection contracted from the healthcare institutions. If we make a comparison, these infections, the healthcare acquired infections, could kill more than AIDS, malaria, and TB combined.
Okay.
In the West, these infections are the second leading cause of death. In USA, 200,000 people die every year, and that's equivalent of a 747 crash every day. In France itself, 770,000 French people contract a nosocomial infection and a hospital acquired infection every year. 40,000 of these infections of those patients are deadly. So these are actually statistics that is available worldwide, and it can be accessed from different sources, including the WHO source or the Clean Hands Save Lives website.
Okay.
If we go through the development of this campaign as well, in 1992, Professor Didier Piquet calculates that with the soap and water, a caregiver should wash his hands 22 to 44 minutes per hour. To avoid contaminating his patients. It is not practical, obviously. In 1993, in his hospital, he replaces the hand washing in the sink with disinfection with hydroalcoholic solution, which kills 99.9% of bacteria in a few seconds.
Right.
2 years later, he introduced this strategy, and then he found, after studying the effect of it, that he reduced the number of victims in his hospital by 50%. In 2000, he published his results in The Lancet, one of the most popular and one of the most recognized scientific magazines. In 2005, the WHO launches its global campaign for patient safety, and then that was extended in 2009 later on to be this campaign. At the moment, according to my knowledge, like more than almost 170 of the 194 UN member states have joined the campaign, which covers 80% of the world's population.
Right. Well, thank you for sharing this. And we understand really the need of proper hand hygiene, especially for healthcare workers, who are performing and who are taking care of patients. So, Dr. Hussein, can you tell us as well, what are the key moments when healthcare workers should really perform hand hygiene?
Yeah, there are 5 moments of hand hygiene that's to be practiced. The first, before touching the patient. The second, before any kind of clean or aseptic procedure. The third, after body fluid exposure or being at risk of. The fourth, after touching a patient. The fifth, after touching patient surroundings. So these are the 5 moments that the healthcare worker has to practice with each patient every single day. And of course, there are posters everywhere these days in most of the healthcare facilities on how to hand rub or how to hand wash, which is made available perhaps next to each basin or each washing facility. Yeah.
Well, indeed, that's really good to know. Especially right now, we always highlight, doctors, nurses, everybody in the healthcare sector for, especially during this pandemic times. And I believe that, effective hand hygiene is really one of the focuses, especially these days. So, Dr. Hussein, talking about this theme or the campaign, who are the target people for this?
Yeah, absolutely. I second on what you've just said. The hand hygiene, basically, it's the entrance door for reducing the healthcare-associated infections and patient safety. It's a simple action that can grow into big changes, improving quality of care and leading to healthcare for all. So basically, the healthcare workers are number one who are targeted by this campaign.
Okay.
The facility managers, the policy makers, and of course, the patients and families are a part of this campaign as well. So we always tell them to help us in order that we can help them by cleaning their hands.
Well, from the theme as well, clean your hands, this kind of global campaign, I think bringing people together in support of hand hygiene around the world. Dr. Hussein, thank you so much. But just in closing, can you share with us your message or reminder to the public?
So basically what I would say, it's a human right to ask for clean care. So I wouldn't feel offended if one of my patients asked me, have you cleaned your hands, doctor? So basically my practice is today and every day is not letting the patient asking for that. Instead of that, I'm proactive and I would wash my hands in front of my patients. So that will boost their confidence that I'm practicing having a good practice. I'm trying to promoting this hand hygiene, and I'm trying to give them a safe, clean practice without the risk of transmitting infections to them. And not just that, actually, I clean my third hand. Yes, my third hand. You would be surprised. What is the third hand?
What is the third hand, doctor?
Yeah, it's my stethoscope. And the stethoscope that's used by the doctors from patient to other, it is a source of transmitting infection if it's not being disinfected. So in my practice, I do wash my hands and I do disinfect my stethoscope in front of patients. That will boost their confidence. Now, as part of the final message as well, I found the website Clean Hands Save Lives, all one word, cleanhandsavelives.org, is a useful website. And as a public member of public, you can insert your photo there. You can send it to WHO. You can share it on social media. It will appear as a poster to promote the campaign of hand hygiene. It's very simple. There are editable versions of posters you can download on your desktop. You just insert your photo, you group photo if you wish, and you can share it on different platforms of social media. That I could see that as a solidarity from the public in regards of this campaign.
Right, to raise awareness and, of course, encourage everybody to do same. Thank you so much, Dr. Hussain, for joining us this morning.
Welcome.
Have a lovely day.
Same to you. Thank you very much for the invitation.
Thank you so much.
See you. Bye-bye.
Bye-bye. So we just had Dr. Hussain Alsaffar right here on the nation station Oman FM, a pediatrician, and he just mentioned and he just shared with us the importance of the World Hand Hygiene Day, which is celebrated actually annually on 5th of May. So the aim of it is to maintain global promotion, visibility, and sustainability of hand hygiene in healthcare and to bring people together in support of hand hygiene, not only in the country but around the world. And this is really an important occasion by WHO as well, calling on healthcare workers and facilities to achieve effective hand hygiene action at the point care.